morning, everyone. So when I started practicing, we were using paper chart. And I was fortunate because I was at this beginning of a revolution of the internet that I've got everybody excited. And we said, we're going to computerize healthcare. We're going to computerize our hospital. We implemented all of these different tools. And yet I stand here today, and this is not my reality. This is what Star Trek promised I would be practicing with. It had the genome on one side, a whole bunch of wearables and biometrics. I could actually see people's blood cells when they're voting. And that's not how I'm practicing today. And I would love to talk to you more about some of these exciting developments that are happening in healthcare. And people are writing these books about all the potential that we can have with the innovation and R&D of how we're spending. And Eric Topol is a physician in the US who's done a really good job. His first book was not The Doctor Will See You, but The Patient Will See You. He just released a new one on deep medicine and health and AI. And everything he describes in there, everyone agrees we want. We want this as physicians. We want this as patients. We want this for our loved ones. I would recommend Ajay's book, Prediction Machines, is a way better read on how AI is going to impact us. But in the meantime, this is an image of a waiting room near you. And for those of you who've had to unfortunately consult our healthcare system in the last little while, you will discover that that's what the clinic feels like and looks like. And we have these theoretical discussions about, will AI cause harm, or how do we protect data privacy when people yell out and it's like, are you here to see the hemorrhoid clinic doctor? And you're like, well, so much for privacy in that room. So this is a recent tweet. This is why I do what I do, and I don't stop and say it's easy to just sit in the system and keep billing and doing what we're doing before, because this is a doctor in the US. He's the MD lead for patient safety at the Department of Veteran Affairs, in charge of EHR, Electronic Health Records Modernization. And this is his tweet. So my dad is in hospital with a complex problem. In a perennially top-ranked facility, he is an MD. I am an MD. I can't navigate my dad's care. I'm struggling and, all cap letters, livid. You can feel this frustration that he's having. And he says, if I can't do this, no way anyone can. And so if that is our reality, we just have to persist and change things. And the part of, many of you invest in healthcare startups. And what I wanted to say is, don't despair. We are still in the deceptive phase. For those of you who haven't seen it, this is the Singularity University 6D framework where things get digitized. There's a deceptive phase, and then you get the disruptive, dematerialized, demonetized, democratized. And so the example for that is Uber. Initially, it was limousines, and then it became transportation, and now we have all of these Uber pool and sharing, and it's much more affordable than a taxi car ride. So we are in a deceptive phase of healthcare, and I firmly believe this. And there's more in-depth analysis that confirm that. This is the blue line at the top is where we thought we were going to be. So starting in the 80s, about now. The red line is where we are. There's a disappointment threshold. Everyone keeps asking me, why do physicians hate technology so much? And I said, well, just look at what they have on their wrists and their pockets and what they personally use. We love technology that works. We are forced to use technology that doesn't, that wasn't designed for clinical care. No one did UX testing. All of the brilliant technologists went and created Google. None of them want to get union-based salaries in the hospital system. And so our products, our technology tool suck. The green line is the hopeful one, and I think we're hitting that stride. In the meantime, this is an entire industry that made people rich. And so this is one published data for Epic. Epic is one of the 4 major electronic health records that hospitals use. And so this is their published data in an industry that didn't exist at all in the 90s. They now are at 2.5 billion in 2016, and people say that lately they've really shot up. And so people can make money even though the system is not efficient and is not doing well. And all of the data shows that more and more people are investing in health and more money is spent. And yet the reality, the gap between what I thought we were going to be doing and what you experience in daily life is still there. And so part of what I wanted to give you is, after having spent a lot of time looking at different models and why and how, is 3 insights that will hopefully help you in what you're doing in terms of trying to change the healthcare space. And the big idea is, I don't think MBA models on healthcare work. And so we need to actually learn from biology. And so my colleagues who invented organ transplantation were very inspiring, because when you invent organ transplants, You cannot have one of the body systems fail. You have to ensure that every single system that's designed to reject an organ is being neutralized or put away so that the body will accept this foreign substance as its own. And so in healthcare, it's very similar. You cannot fail. You have to have privacy, security, regulation, business model, clinician adoption, patient satisfaction, evidence-based. And so you really need to think through every single type of system that affects your innovation, because the healthcare system desperately needs your innovation, and yet just as a patient whose life was about to be saved by a transplanted organ, everything in there is programmed to reject it. And so we need to figure out how do you analyze all of these factors for each of the ventures you have, and figure out how do you neutralize it, what are your friends, what are your enemies in that equation. The second big insight was learn from business. And so I concluded I should stop being on some of these committees where you go and have comfortable conversations that feel like deja vu for 15 years. And you go and learn what have business world invented that is transformational. And the one thing that emerged to me is we've done a really good job in healthcare. We now save lives that people used to show up in Emerge and a week later patient was dead. But you can live with HIV, you can survive cancer, you can have multiple body transplant organs, and so you can live for 30 years, but you accumulate a number of illnesses. And so the fragmentation has gone so much worse. But we've actually created a whole bunch of solutions. You have all these specialists that you can go visit and all these tools you can access. And in the last 10 years, you have 320,000 apps in the App Store dedicated to health. And so why has all of that not emerged as something that is transformational? And the answer was, well, fragmentation. In the business world, companies came in and said, it makes no sense for everyone to be building their own billing tool, so Stripe became a big platform. It makes no sense to have a CRM that everyone reinvents the wheel. It doesn't make any sense to have e-commerce, cost $100,000 to build a website. So Canadian success story from Ottawa, Shopify came in and said, we're going to be the technology layer. We're going to be a true platform. We're going to create a whole ecosystem of success around us. And we're going to provide people without IT skills the ability to actually excel. And so when you take that idea into health, the simple analogy of what I just described is an orchestra. Imagine that every app, every tool, every device in every clinic is this beautifully trained musician who is ready to come and they want to make the best music possible for your benefit. Yet they don't know what the score is, and they have no idea who the conductor is. And so part of our insight, and shameless entrepreneur plug, this is why we created Careteam. This is the fundamental belief that someone needs to create a technology platform to enable all the other innovations so they can better fit into the workflow of a daily life of a physician, of a patient, of a loved one of a patient, and also the decision makers in that space. So look for integrators, look for combinations, because that's something that can help create a breakthrough. And this is not new. In the banking space, people figured it out, but we are in healthcare a couple of decades behind. So remember the times where you could only bank by going to the bank, and now you have all these multi-channels. Healthcare is going to follow, I feel, the same path, but we're going to be a little bit behind, and hopefully through initiatives like CDL, we can accelerate the pace of that change. The big third idea is batteries included. Some of you may have read all of these studies showing that doctors are burnt out. So my profession, 68% shows up at work feeling that there is no hope. I need to do what I need to do and protect my patient from the system. There was a big article in the New York Times on the weekend showing that if we didn't have professionalism, if we didn't go the extra mile, if we didn't argue with the insurance companies or whatnot, the whole system would break down. There's a human toll that's incredibly high. And there's a physician in the States that actually called it moral battle injury. This is equivalent to going into the battlefield every day and sustaining injury because we want to do a better job, but we can't. And innovators in the healthcare space is also tired. Is I constantly go and speak at different events, and sort of the final word at the end is like inspired, because they said, everyone sort of kind of gives up. And you're like, well, we can't give up. You talk to my colleagues in HIV treatments and cancer, and they had to try 1,000 ways, and they just keep going until they succeed. But in healthcare innovation, you have all of a layer of inventors who are basically saying, we tried it these different ways, it didn't work, so nothing can work. It's this PTSD induced by technology that we need to fight through. And so there's a startup accelerator we're part of in New York called Startup Health, and they had a concept that one of the 8 mindsets of a health transformer was the idea of batteries included. And I was a little puzzled by that initially, but I say, accelerators are smart people coming together giving you advice, so let's try and see what it's like. Well, batteries included means you analyze who you meet, and you say, if the encounter with that person just drained my batteries, they were so negative about whatever you're going on, and I've heard this conversation so many times, what you're trying to accomplish in healthcare is not possible, why are you even bothering and all that? And you say, well, if that encounter totally drained you, just walk away slowly from that person and don't take the call or the email. But if that encounter was someone who said look, you're gonna face these difficulties, these ideas about how to solve them, and you kind of oh, I hadn't thought about it this way before. Well, that was a batteries included kind of conversation, and we need to have more of these. And I can't thank CDL enough. We did this last year in the CDL Prime cohort, and many of our mentors in the room, this was like oxygen. This was like me trying to figure out where's my tribe of people who says, I will not give up. With the Churchill, we will fight them on the beaches and we will not give up on this. And so thank you for being here and for doing this. But a good example of something like that happening in the past is Dr. Osler, who is the founder of modern medicine, was a McGill physician. And when he started out, he had these ideas about how to transform education and couldn't get anywhere. And so the Hopkins Foundation, the Rockefeller, and Carnegie hired a retired principal to walk around the US and transform how healthcare education happened. And that happened in a span of 10 years, which was really fast. So we can do the same. So in the meantime, a few quick pieces of advice. Our healthcare system may be broken, but most of it is not in charge of health. So my encouragement is please stay healthy. This is the Canadian Medical Association data showing that genetics, biology is a small percentage of why you become sick. Most of it is your life, most of it is your environment, and a little bit of that is your healthcare. If you haven't looked at the latest book from Dean Ornish about move more, eat well, stress less, and love more, huge amount of evidence that we can reverse diabetes and other conditions, it's a must read. Sleep. Most of us here in this audience are guilty of not sleeping enough. And so when you don't sleep, everything in your body doesn't work. Growth mindset. Cannot recommend this enough because the positivity of how you encounter difficulties protects you from disease. And then the fundamental other thing is if you become sick, one of your family members becomes sick, you need to surround yourself by people. You need emotional, informational, and logistical support. You need a plan of care. You would be surprised how many people go through the healthcare system in a reactive mode. I'll just call my doctor and find out what they say, as opposed to saying okay, I have this illness. What should be happening every day, every month, every week in order for me to be healthy? You need to monitor progress. It's not enough to publish a plan and sort of look at it ever so often. All of us in business know that progress is really important. And then you need the ability to predict. And so we're building this platform as we, and it's starting to be used. It's used by hospitals. Any one of you wants to be a better tester and use it on a loved one? I get these requests all the time. Happy to chat with you about that. But you can also do this by paper. People carry binders around, and those are the patients that succeed. The ones that have a binder where somebody collates all the information. People now use Google Slides and other sheets. And they have a tribe of people around them to support them as they can get sick. Because my inspiration is Nelson Mandela. It always seems impossible until it's done. And we have an opportunity here that may be big in the oceans, but let's say that it's about the same size and let's go fix it. Thank you.